Again, we see regulators and commissioners all thinking or wanting to believe that patient safety was somebody else's responsibility. And it's a terrible indictment of how the current system still isn't fully fit for purpose.
A criminal investigation into the deaths of mothers and babies at Furness General Hospital has been launched by Cumbria Police. In a statement, the Trust acknowledged it has let mothers and babies down, and the care received at Furness General Hospital was simply not good enough. It says it has made recognised progress, adding both maternity units now meet all the essential standards of quality and safety. The CQC told us they have launched a review into their handling of the problems at Morecambe Bay. It's estimated that patient safety incidents cost the NHS a staggering £3.2 billion a year. There are those who believe that much of that money could be saved if the culture of the NHS became more open. Having worked in the health service for more than 40 years, Dr. Heather Wood knows from the inside how the NHS often prefers not to hear bad news.
You quickly learn, if you work as a manager in the health service, that if you are totally honest about the shortcomings of a service, it is not well received.
So in some cases, there's no motivation to be open and transparent?
There's the exact opposite. The motive is to present yourself in the best positive light. People look for easy ways to claim they have addressed those problems. So, in a sense, there's a false assurance given to the public that things have changed, but actually, where it matters, they haven't.
There are people working on the front line of the NHS who do speak out, but often at a heavy price. They've gathered in London to exchange experiences and press for change. Many have suffered professionally for their actions and don't want to be identified. People have gathered here today to talk about the difficulties that they've experienced in raising concerns within the NHS. But what really strikes you are the similarities between what people are saying here today and what happened at mid-staffs. And this is about incidents that are still ongoing now. One of the organisers is Dr. Kim Holt, who first blew the whistle over the case of Peter Connolly, Baby P. She says whistleblowers are routinely silenced.
It's pretty common. I mean, under the radar, there's hundreds and hundreds of nurses and doctors and managers that we're hearing about that basically, they're being bullied into silence.
Is it possible to change it?
Yeah, but I think there needs to be some accountability at the top. That's what we think needs to happen.
Until 2009, David Bowles was the chairman of United Lincolnshire Hospitals NHS Trust.
And it is that culture, that overarching culture, which creates the capacity for so many whistleblowers to be forced out of the door, rather than the issues and concerns that they've raised be properly addressed.
David had been especially brought in for his experience in turning round failing organisations, and within 2 years he had demonstrated clear improvements. But when there was a sudden rise in the number of people using A&E, he raised concerns that hitting government targets could threaten patient safety.
I had doctors saying to me, we cannot put the system under more pressure. If we do, something serious will happen.
His fears about targets and patient safety would lead to a long and difficult dispute with health bosses. When you raised these concerns, what exactly did they say to you?
Very simply, meet the target. So, no interest in discussing the wider issues at all.
But this was an issue of patient safety, wasn't it?
Absolutely.
And you raised that?
Oh, absolutely.
East Midlands Strategic Health Authority told us it acted at all times in the interests of patients and rejects David Bowles' claim that he was forced out of his job. David says that after his departure, the Trust's Chief Executive, Gary Walker, continued to highlight the problems.
I saw the letters that he sent and the emails that he sent, making it clear that he was not prepared to put targets above patient safety. He was suspended shortly afterwards for allegedly swearing.
Gary Walker was ultimately sacked and signed a confidentiality agreement, so he's not allowed to talk to us.
If you've sacked somebody for swearing, and that was the genuine reason for sacking them, you don't pay £500,000 to cover it up and try and seal the documents away and prevent public access to them.
The Trust says a new management team is in place and the top priority is patient safety. They say both the Trust and Gary Walker reached an amicable resolution of the differences between them and agreed not to comment further. If patients, doctors and managers aren't listened to in the NHS, surely the Care Quality Commission, the regulator whose job it is to monitor safe care, would listen to its own whistleblowers. Not according to Amanda Pollard, one of its inspectors. Why did you blow the whistle?
I was concerned that what we were doing wasn't safe. And I felt the claims that were being made were not correct. They were not true.
Concerned at the quality of inspections, Amanda spoke out when the CQC increased its inspectors' workload without adding substantially to resources.
They were saying that we'd all been adequately trained, more than adequately trained, and I don't agree with that. We hadn't been. And I was being forced down a line where I had to go in and inspect and keep a bit of a tunnel vision and not look too deeply, because otherwise I'd never get through the quota of inspections I had to get through.
She feels she's been punished for doing the right thing.
I feel I have suffered professionally because I've blown the whistle, most definitely.
In a statement, the CQC told us we accept that workloads were high and training was not as effective as it should have been. They say that additional inspectors have been recruited, adding, "We have been working hard to improve and support staff." Panorama has had exclusive access to new data on death rates in hospitals in England from the independent research group Dr. Foster Intelligence. They track 4 different measures of hospital mortality. If hospitals score highly on more than one of the 4 measures used by Dr. Foster, then it's accepted that unless properly investigated, there could be an underlying problem. Now this year, of the 144 hospital trusts in England, 12 of them were identified as having high mortality rates across 2 separate indicators. And for 9 of them, it's the second year running where mortality rates have been high. This year, death rates for Mid Staffordshire and Morecambe Bay trusts have fallen and are currently what's called within the expected range. At the time of the scandal 5 years ago, Mid Staffordshire Trust was undergoing huge structural change coupled with severe financial pressures. Now, the NHS faces the biggest reorganisation of its history in a time of austerity. And some experts fear that patients across the country could become less safe as a result.
I'm not confident about it. That's partly because I think any reorganisation brings with it risks. It takes people's eyes off the ball.
We're currently seeing the conditions which could be described as a perfect storm for something like Mid Staffordshire happening again. Not only do we have funding pressures, massive reorganisation, low morale, and at the core of the reforms, further fragmentation of the system is being made more complicated.
Despite their improved performance in Dr. Foster's mortality figures, there are still problems at Mid Staffs. In March this year, experts from the National Cancer Peer Review Team looked at their breast cancer services. The results weren't widely publicised by the hospital, but they were unearthed by Julie Bailey, founder of the campaign group Cure the NHS. What does it find?
The team remains deeply dysfunctional, and the review team is seriously concerned about the effect on patient management and safety. and they have self-assessed themselves at 93.6%.
Right, so this 93.6%, this is the score the hospital has given itself for how good a service it's providing in terms of breast cancer.
That's right, yes.
What did the inspectors, the peer review group, think?
The peer review has actually given them 9.7%.
But this is from this year. What does that tell you?
That the hospital is still failing and they're very good at spin.
But that's as if nothing has changed in the 5 years since your mother died.
That's correct. Mm-hmm.
The Trust says the terrible care received by Mrs Linstead and Mrs Bailey is not representative of the care patients now receive, adding they've made significant improvements with low mortality rates, reduced infection rates and increased nursing staff numbers. The Trust says we do not hide the facts when things are not as good as we would want them to be. We can assure women that our breast service is safe. Next January, the report of the long-awaited public inquiry into the scandal at Mid Staffordshire will finally be published.
One of my biggest fears for the outcome of the Staffordshire public inquiry is that the government will try and convince us all that changes have already taken place, that this is an historical issue, and that the new system will somehow deal with the problems that led to Mid Staffordshire. That couldn't be further from the truth.
I hear from people on a daily basis throughout the NHS, and what happened at Mid Staffs isn't dissimilar to what people are experiencing from all over the country.
The Health Secretary Jeremy Hunt has gone on record saying we have to be honest about failures, and he's promised to hold hospital managers to account for poor standards. But how widespread does he think those poor standards really are? In a statement to Panorama, he said, "Whilst failings in care at Mid Staffordshire have shocked many, we cannot say with confidence that some of those failings do not exist in pockets elsewhere. Whilst the majority of patients receive excellent care from the NHS, we still have much to do." He said the current reforms give much more power to the patient, adding that putting in place proper structures and safeguards to sort this out is a major priority. So what needs to happen for the NHS to improve patient safety across the country?
I think what needs to change is somehow or other a cultural change of a real acceptance that not everything is right all the time. But if things aren't right, they should be exposed honestly so lessons can really be learned.
I have a huge amount of respect for people who work hard in the healthcare system. I think some of our doctors and nurses are fantastic. But I'm just hugely, hugely disappointed that the underlying culture of the organisation does not place safety at the heart of it. And I think that does not serve any of us very well at all.
It seems we'd all feel better if those in the NHS could learn to listen to bad news. And if they can do that, maybe in future fewer families will have to hear the worst news of all.
For details of organisations which offer advice and support, go online to bbc.co.uk/actionline, or you can call the BBC Action Line to hear recorded information on 08000 560 780. Lines are open 24 hours and free from a landline. Mobile operators will charge.